Hi everyone, welcome to our this month's Living to 100 webinar series. I'm Dr. Tom Neblett from Four Points Family Chiropractic, and it's fantastic to have you here with us today. Every month we dive into a new health topic, these topics are dedicated to helping you and your family achieve long-term wellness. Today we're going to focus on something that often gets overlooked when we think about our posture, but can have profound implications on your health, and that is your posture. All right? Many people think of posture primarily in terms of the impact it has on our appearance. Are you standing up straight or are you slouching, for example? But in reality, posture impacts much more than just how you look. It can impact your overall health. So we're going to talk about that today. We're going to talk about 3 common bad posture patterns that can negatively impact or influence your well-being. We'll also discuss how these patterns can accelerate joint degeneration and affect aspects of your health both positively and negatively. Before I jump into that though, if you're looking for a chiropractor, our office is located conveniently on Northwest Austin off of Ranch Road 2222, near where it intersects with FM 620. But we proudly serve patients from all over the Austin area as well as many of the surrounding communities. So if you're looking for a chiropractor, that's where we're located. Now, after we complete the webinar today, if you'd like to revisit this information, or maybe you think of somebody that you know has posture issues that you think would benefit from watching it, if you head over to our website at fourpointschiropractic.com, click on the Watch a Webinar tab. Immediately following this, we'll post this webinar on that site, but also there's a whole treasure trove of past webinars and workshops for you to explore. And as part of our commitment to you and our patients, to give you resources to live the healthiest life possible. All right? So when it comes to understanding posture, let's start first by defining what we mean by the word posture. Posture refers to how we hold our bodies when we stand, when we sit, or when we lie down. All right? Good posture minimizes stress on your spine and supported muscles. All right? So in an ideal posture, when we look at you from the front or the back, your head should be balanced over your shoulders pelvis should be level with the floor horizontally, as well as your ears. Now from the side, your ears, shoulders, hips, knees, and ankles should all form a straight line. Very simple. So that's an easy idea you can use to screen your own family members. So as I mentioned, maintaining good posture not only reduces stress on your spine and supported muscles, but other things that does for you. Number one, it promotes efficiency of movement. It increases endurance. It moves you towards better balance, and it helps increase an overall sense of well-being. Conversely, poor posture leads to increased stress on your spine and on your body. It accelerates degeneration of joints with that misalignment. It can decrease efficiency of movement, decrease endurance, cause balance problems, take away from your overall sense of well-being because you know you don't look the way you should, and it can even impact vital organ function. So posture is very important. Now, when people come to see us, there are posture patterns that tend to be more prevalent than others. 3 patterns we see on a pretty regular basis in our office that are examples of poor posture. I want to talk about. One of the most prevalent postural problems we see is called head forward posture. It's also known as tech neck or text neck. This occurs when the head protrudes forward from the shoulders, head's out here, and this particular pattern is often accompanied by a reversal of the curve in the neck. Our neck should look like a banana from the side. So what happens as the spine breaks down is we'll see that curve begin to go the wrong direction. And when that, you can imagine if I kept doing what the banana would do. The banana, when we take our spine that should be curved like this, and we reverse that curve, it increases the stress on the joints in the spine, causes that to accelerate the breakdown of those joints. It also stresses the spinal cord where it attaches to the brainstem back here, and can lead to all kinds of problems. So when we have this particular condition, also an increased curvature of the upper back is common, rounding of the shoulders commonly accompany it. But the way that tends to show up as far as symptoms for people who have that condition, it's very common. It increases the prevalence of sprains and strains because of the abnormal position of the neck. It increases the incidence of neck pain. It can lead to headaches. It can lead to TMJ problems. And one thing you may not be aware of, it can also compress vital organs like the lungs and the heart as everything presses forward. And what that can do is create breathing difficulties because of the compression of the lungs where you can't take a full breath. It compresses the heart, so the heart's not working as efficiently as it should, can decrease cardiac output, and it can even lead to digestive problems. So head forward posture is a lot bigger deal than just seeing that abnormal appearance. Now, a second condition that we see on a regular basis is called hyperlordosis or swayback. All right. This particular condition is characterized by an exaggerated lumbar curve. As you know, the lumbar spine is the low part of the back. All right. This is your tailbone or your sacrum down here. This is the lumbar spine. With a hyperlordosis, instead of having a 50 to 60 degree curve, we'll see a much greater curve in the back. Needless to say, that increases the stress on the joints here in the lumbar spine, can speed up the breakdown of those joints, can lead to accelerated spinal degeneration to those joints, but it can also impact your hips and your knees because, again, that's the attachment between the legs and the rest of the body. So when your pelvis is abnormally aligned, it passes extra stress onto those hips and knees. But it also can compress the abdomen and pelvic regions of our body and can lead to digestive distress and issues with reproductive organs. Now, the third condition we see on a regular basis in our office is a high shoulder. All right? The reason that a high shoulder concerns us is that can often be indicative that the patient is developing a scoliosis, or they may already know they have scoliosis, because as the spine curves, as you know, scoliosis is a lateral curve in the spine where the spine curves that way. As the spine curves, that will drive one shoulder down lower than the other. Make sense? Now, scoliosis can be caused by a variety of reasons, but the main cause of scoliosis is called idiopathic. And what an idiopathic scoliosis is a scoliosis that we don't know what caused it. It just developed. There might be a hereditary predisposition. It's very common for us to see in families. Mom has a scoliosis and so does her daughter. And we'll put them up side by side, their x-rays, and they're almost identical. So it is common to see a family predisposition towards that. Something to be aware of is where scoliosis is typically, as you know, diagnosed in teenagers, most commonly among teenage girls. Scoliosis has the most opportunity to progress during the teen years before the teenager reaches skeletal maturity. Skeletal maturity is the point where the growth plates fuse, and that's the time when bones stop growing. So we see the largest increase, acceleration, if you will, in curves during the period between about 12 and 15, and that's documented in multiple studies in the literature. So that is the time it's most important to check your kids to find out if there is a curve developing, and if there is, to take steps to manage that to keep it from becoming worse with time. Does that make sense? Now, girls tend to reach skeletal maturity between the ages of 14 and 16, boys between 16 and 18, just so you know. So when we have the opportunity to work with kids during the periods before they hit skeletal maturity, as I mentioned, we can often make a difference so that they don't have bigger problems down the road. Because when the spine gets into that abnormal alignment with curves, the joints begin to break down very rapidly. Now, a couple of interventions. If you go the medical route, the medical profession tends to take a stance called wait and watch. If they notice a scoliosis, they'll x-ray it. If it's below 30 degrees, there's not much they can do. So they just say, let's re-x-ray every 6 months. If it gets bad enough, 30 degrees or greater, then we can discuss bracing, where you wear that full body brace to try to keep the spine, the curve from progressing, or do a procedure called Harrington rod surgery. It's a very difficult surgery. That's where they're going to cut the back open, implant rods on either side of the spine, fuse those rods to the spine so the curve doesn't progress any further. Needless to say, we want to do everything we can to help kids prevent that. When we work with kids with the scoliosis, we take a different approach. We want to intervene with spinal adjustments along with exercises for the kids to do at home to take an active approach to stop that progression of the curve and even if possible, maybe even reduce it somewhat. But that is the approach we take. Early detection and intervention are crucial to managing scoliosis to prevent severe complications. The reason it becomes a concern when that curve gets over 30 degrees is that compresses the cavity where the chest cavity, the thorax where the lungs and the heart are, and if there's too much compression, then it puts those organs into a dangerous position. So that's why it has to be often stopped through surgical intervention if it gets bad enough. As I mentioned, if we can do anything to keep it from getting there, it's to your benefit. So the point I'm making, postural distortions are often signifying misalignments of the spine that underlie them. Those conditions are called subluxations. And subluxations can have serious health consequences down the road if they're not caught and corrected. If you or somebody you care about exhibits any of the postural issues I just talked to you about, it's very important that you consult a licensed chiropractor. Okay, if you will call our office at 512-345-9355, mention this posture webinar, then we're offering a comprehensive spinal examination that will include an in-depth posture exam, a biostructural assessment, orthopedic and neurological evaluations, any necessary x-rays, and a follow-up appointment to review the findings of your exam with you and discuss treatment options with you. Okay, we're offering all those. Normally the cost here for that is $348. We're offering those for just $97. If you'll call the office, mention this webinar, we want to help. All right, and then they'll help set all that up for you. In addition, as a bonus, we're going to gift you a cervical support pillow by BodyMed that we sell in our office for $55. We're going to give that to you at your follow-up appointment. That pillow is very helpful in addressing head-forward posture issues. All right? Now, let's talk about why good posture is important. As I mentioned, it's more than just about appearance. It is a critical component of your overall health. As I mentioned, efficiency of movements affected, balance, sense of well-being. But one of the real important things is when the joints are properly aligned, the wear and tear on the joints is minimized. So I'm going to talk more about that in just a minute, but that's one of the reasons it's so important to keep those joints aligned so your spine the spinal joints don't wear out abnormally fast. But proper alignment also has an important on vital organ function. If we take it to the other way with the poor postures I mentioned, it accelerates joint breakdown. The reason it does that, if you think about tires on your car, if you drive your car with one of your tires out of alignment, what's going to happen? You're going to feel the wobble of the tire, but while that's happening, the rubber's wearing out on your tire. And eventually, the tire becomes no good. The same thing happens to the joints in our spine when those joints are misaligned. All right? It causes the disc and the joints to begin to wear abnormally, and eventually it'll get to the point where the disc is in real trouble. So proper alignment of the joints is critical, and poor posture can be an indicator that you may not have that occurring, which is important to get it checked out to see if there's something we can do to help with that. But as I've mentioned also, that the abnormal postures can lead to reduced lung function, reduced cardiac output, circulatory difficulties, digestive stress, reproductive issues. That lack of cardiac and lung function can also cause fatigue and lead to diminished cognitive function. So these can have very far-reaching consequences. Think of your posture as a window to your spinal health. All right? So as I've already mentioned, if you're looking at somebody, one of the posture patterns I mentioned is real prevalent. That's telling you that there's probably joints that are wearing abnormally, and some of the other things could be occurring as well. So monitoring your posture is essential for maintaining and enhancing your health, and I hope that became clear in the things that we talked about today. All right, I hope you found today's webinar enlightening and even more so motivating. All right, if you see somebody in your family that you can tell has got one of the postural problems that I mentioned, the earlier those things are caught and dealt with, the easier it is and the better prognosis your child is going to have as far as their quality of life goes in the future. And the same goes for adults. Even if you're an adult and notice those things, we can slow down and stop the progression of degeneration if we catch these things earlier on. So if you notice somebody in your family that's dealing with one of these issues, Easy to check. Have your child face away from you, look at them from behind, put fingers on the top of their ears, on their shoulders, and on their hips. And if those aren't properly aligned, one's higher than the other, there could be a scoliosis developing. When you look at them from the side, if their ears are forward of their shoulders, that means they've got head forward posture. You can often tell looking at their low back. If there's an exaggerated curve in the low back, they're probably developing a sway back. All those are indicators of abnormal joint function. So if you see that, or if you see it in the mirror, or if you're just interested in improving your overall health and seeing how chiropractic might be able to help you with that, I want to encourage you to don't wait and give us a call, all right? If you call us at 512-345-9355, schedule the comprehensive examination I mentioned earlier with a postural exam, biostructural assessment, neurological and orthopedic examinations, any necessary x-rays, followed up with an appointment to review all those, to go over all those findings with you, discuss treatment options if needed. We normally charge $348 for that. We're offering it for $97. Call our office, 512-345-9355. We'll set up that appointment for you, and then when you come in, we're going to gift you a cervical correction pillow to help with issues like head forward posture. One last thing. If you would like a list of posture correction exercises that comes with instructions on how to do them, I've prepared a list of those exercises you can do for the different conditions I mentioned. If you'll email me at Dr. Neblett at fourpointschiropractic.com, that's Dr. Neblett, Neblett, at fourpointschiropractic.com. In the memo section of the email, put posture exercises. I'll send those right out to you immediately, so you'll have exercises that you can begin to do at home. That doesn't take the place of correcting the spinal problem, but at least you can be strengthening muscles that work for you instead of against you. But that's a gift for watching today's seminar. So I want to thank you for joining us today. Next month, you're in for a treat. Dr. Mary is going to delve into brain health, and she's going to share strategies with us for enhancing memory. So if you catch yourself walking to the other end of the house and can't remember why, tune in. She's going to give you some good strategies to help with that. We look forward to seeing you then. In the meantime, this is Dr. Tom Neblett. I'm here today to show you a better way to health and wellness.